Our next question is, how do you know how much filler to use? Well, the real answer to that is you know how much filler to use when you achieve the facial appearance that looks good. This is why it's really important to have an experienced injector who has done a lot of filler and who's taken the time to have a thorough discussion with you, the patient, regarding what your goals and desired appearance are going to be. Then you can select the appropriate fillers in the appropriate amounts and achieve the effect that you have decided to shoot for. I think that increasingly we're seeing folks who have probably had a bit too much filler, and you get this distinct overinflated appearance to the face, and that can be avoided by, again, having a good understanding on the part of both the injector and the patient of what you're trying to shoot for with your aesthetic goals. And that gives me a good idea for a demonstration of how filler volumes work. I'll have to do that at home for you though. Hi, Dr. Beaty here. Wanted to show you a couple of things to give you an idea of how filler works and what kind of quantities are used when we inject filler in various parts of the face. So to start with, I want to give you an idea of how much filler there is in the different syringes we use. The most common size syringe that we use has 1 cc of filler. And I'm going to lay that out for you in a bead on this parchment paper. So that is the amount. This is sitting next to my hand. That is how big an average syringe of filler is. Now sometimes we'll use smaller syringes of filler. The next most common size is 0.6 of a cc, and I'm going to lay that out right next to it. So this represents the typical amount of filler that you would get with most augmentation procedures. 1 cc syringe, 0.65 cc syringe. Now I've pushed this directly out of the full-size syringe. When we're actually placing the filler, it is usually pushed through a 30 gauge needle, sometimes as large as a 27 gauge cannula. And what I want to show here is the size of the actual bead of material as it's being placed into the soft tissue of the face. And you can see that relative to the other beads that I lay. So if we were to use a threading technique, it would be something like this. The other thing that we'll often do is use an intermittent micro droplet technique, especially when we're doing deeper injections for things like cheek augmentation. So hopefully that gives just a little bit better idea of the actual volumes of material that are used when we're augmenting the face with injectable fillers.